Hi, I'm Deborah Greenwood, your 2016 Immediate Past President, along with Hope Warshaw, this year's President. We want to take a few minutes to introduce you to AADE's new and very exciting 2016 to 2018 Strategic Plan. The plan was finalized and approved by the AADE Board of Directors in late 2015. This is an ambitious strategic plan, but one that your AADE board and staff know is achievable. I'll provide background about how the plan was developed, as well as an overview of several elements. Then I'll hand it over to Hope to delve a little deeper into our key priorities, strategies, and outcomes. As you likely know from strategic planning work you've done, it's a process that begins with a goal in mind. Your AADE Board of Directors goal was straightforward: to grow and strengthen the profession of diabetes educators, to prepare our members for the future, and to be their advocate within the larger healthcare arena. Our planning kicked off back in mid-2014 with an environmental scan where we spent time seeking input from a wide spectrum of AADE stakeholders, including past and present AADE leaders, AADE staff, representatives from related healthcare associations, industry partners, people with diabetes, members of the diabetes online community, advocacy groups, payers, employers, key government agencies, and you, our members. We also examined the trends shaping diabetes care and education today and predictions for the future. We know that technology is having a dramatic impact on the delivery of healthcare services, and diabetes management and education is no exception. The workforce is changing, with diabetes educators expanding their role as chronic care managers and care coordinators, as well as partnering with diabetes paraprofessionals to provide diabetes education and prevention services. As a result, the roles and competencies of educators are evolving as healthcare and education delivery models advance and diversify. An early premise of our planning efforts focused on our collective desire to ensure that the person with, affected by, or at risk for diabetes and related chronic conditions is at the center of the work we do and the decisions we make as an organization and for our profession. To emphasize this focus and to fully understand the environmental factors that impact the lives of people with diabetes, the board developed AADE's Diabetes Educators Spheres of Influence framework. In short, this framework depicts the interdependent nature of a system and where diabetes educators have opportunities to engage to improve diabetes care and education, including the community, the healthcare system, e-communities, and then, lastly, the global environment. You'll find this framework and the details about the entire 2016 to 2018 strategic plan on the AADE website. As part of the strategic planning process, we spent considerable time reviewing our current vision and mission. They were both updated to be more future-focused and reflect the importance of innovation. Our vision now reads: optimal health and quality of life for persons with, affected by, or at risk for diabetes and related chronic conditions. Our mission now reads: empower diabetes educators to expand the horizons of innovative education, management, and support. And we established 5 guiding principles to communicate the core beliefs that support our vision and mission. Our guiding principles are simple but powerful. The person with, affected by, or at risk for diabetes is at the center of the diabetes care team. The diabetes educator is an essential member of the diabetes care team. Evidence is the basis of our science and practice. Quality diabetes prevention and diabetes self-management education and support should be accessible to all individuals. And diabetes self-management education and support must evolve through innovation to reach its greatest impact. Now I'm going to turn it over to Hope.
Thank you, Deborah. I'll now walk you through our 4 key priorities and then highlight several of our strategies and outcome. First, our 4 key priorities. 1 will lead the development of innovative education, knowledge resources, and services for professional development and career enhancement. 2 will champion the positive outcomes and cost benefits of diabetes self-management education and support. 3 will expand and diversify the evolving diabetes educator workforce to address the increasing demand for and access to diabetes self-management education and support. Lastly, looking towards the future, we will shape, design, and drive opportunities related to technology and connected health to improve outcomes. Now, let's talk about our strategies and outcomes. First, AADE will continue to invest in resources that address the emerging roles and practice of diabetes educators at all practice levels, including the paraprofessional. This includes creating a digital body of knowledge that supports and promotes our work and helps grow the numbers of competent diabetes educators by building a diabetes practice specialty within academic settings. Second, we want to ensure that diabetes educators are increasingly valued members of the diabetes care team and have enhanced roles and responsibilities within various new models of care. To accomplish this, we'll create models that showcase best practices and continue to conduct and disseminate research that promotes your value. Your board also felt it was critical for AADE to look inward to ensure that our resources, products, and members represent and serve a broad diversity across generations, ethnicities, disabilities, and cultures. We will also look outward to expand our reach. We'll explore opportunities to expand the impact of our work through global initiatives and partnerships. We're all reminded every day about the role technology is increasingly playing in our lives. Our new strategic plan includes a commitment to expanding and leveraging digital technology, as well as determining how diabetes educators can engage in and provide services in the environments of connected health and telehealth. Advocacy will also continue to be a focus at AADE. This will include advocating for state licensure for diabetes educators. Our efforts will also ensure that diabetes education is integrated into new models and adequately covered. We know our strategic plan is ambitious, but we also know AADE and you, our members, are up to the challenges ahead. The next few years promise to be exciting ones for our association and for each and every diabetes educator. On behalf of the AADE board and AADE staff, Deborah and I hope that you're ready to partner with us to achieve our ambitious outcomes by the end of 2018. Thank you for all you do on behalf of people with diabetes.